Regarding the Exeter, it is a double taper stainless steel design. It is modular. You can put another size head. It has self-locking sliding taper or force close design, intended to subside to a stable position of 1.5 mm in 12 months. Hoop stresses provide circumferential compression around the stem. Polished stem with controlled subsidence as cement goes creep and stress relaxation. As cement undergoes creep and stress relaxation, this transfer loads to the cement evenly. Cement bond to bond and not Cement bonds to the bone and not to the implant. No collar, neck cut level or rotation is critical. Avoid gap in cement mantle. Cement is strong in compression. It uses the principle of viscoelastic properties of PMMA. It's a sliding matte finish with design. A matte finish design was introduced in 1980s as the importance of polished surface is preventing osteolysis and loosening was not well appreciated. Always use centralizers to allow subsidence without point loading. You should have a uniform cement mantle of 2 mm surrounding the implant to minimize risk of cement fractures.